Good afternoon, everyone. At the outset, I would like to thank AIOS for giving me this opportunity. So I'll be starting with my presentation, our experience with Ferricimab, new kid on the block. So most of it is covered by Bhuvan sir and Vishal sir. So it is composed of two heavy chains and two light chains. It is a molecule with two targets. One ligand binding arm binds to VEGF-A and the other binds to angiopoietin-2. And it has a modified FC region which decreases its systemic exposure, which thereby reduces its pro-inflammatory effect. So all of this is covered. We all know that Ang1 binds to Tie2 receptors, and normally in a healthy retina, Ang1 outnumbers Ang2. But in cases of neovascular AMD and DME, Ang2 competes with Ang1 and binds to Tie2 receptor, and thereby it downregulates the phosphorylation, and thereby it increases inflammation, it increases permeability, and the VEGF-A binding to VEGF-2 receptor leads to neovascularization. So Ferricimab, as we all know, is capable of binding to both VEGF-A and Ang2 without any binding to Ang1. So we've all gone through all these clinical trials, AIOCMT and RHINE, and they concluded with a durability of almost 62% patient can be injected 16 weekly. Tenaya and Lucerne were also done, and they also concluded that around 63% patient can go up till 16 weekly dosing. So coming on to our cases, our first case is a 55-year-old female with a bilateral PDR. She has a left eye CSME. 3 settings of PRP laser had already been done. She had received multiple anti-VEGF injections elsewhere. Came to us, we started with anti-VEGF, aflibercept were given, ranibizumab was given, and then we shifted to Ozurdex. So this is a representative OCT showing CME. So at this juncture, we gave Ozurdex to the patient. 4 weeks post-implant, the CME had gone, it had all resolved. But at 16 week, it had come back again. The recurrence was there, and this was the usual pattern with Ozurdex. So at that time, we offered an alternate to the patient, and Ferricimab was injected. So as we can see, 4 weeks post-injection, the CME had resolved, maintained at 16 weeks, and there was a recurrence at 24 weeks. So second case is a 79-year-old male with the right eye neovascular AMD CNVM. Patient had received 4 aflibercept injections. So as we can see that this IRF with CNVM, aflibercept was given, and it resolved after 4 weeks. But there was a recurrence at 8 weeks. So at this point, Ferricimab was injected, and as we can see, it had resolved well after 4 weeks, and it maintained till 8, and there was a recurrence at 12 weeks. So the time period, so the duration had shifted from 8 weeks to 12 weeks. A third case is a 69-year-old female with the left eye PCV. A total of 20 injections has already been given to the patient. We have tried everything, ranibizumab, aflibercept, brolucizumab. And here we can see a representative OCT seeing the PED with SRF. Aflibercept was given. 8 weeks post-injection, there was a minimal kind of response, or there was a recurrence. Patient was not followed up at 4 weeks. Patient directly came to us at 8 weeks. So again, we injected aflibercept. At 4 weeks, we can see a flattening of PED, and SRF had completely resolved. But at 8 weeks, again, there was a recurrence. So at this point, Ferricimab was injected. And as we can see, 4 week post-injection, this complete flattening of PED and SRF had completely resolved and maintained at 12 weeks. And then there was a recurrence at 16 weeks. So the patient had shifted from that 8-week recurrence period to 16 weeks. Our fourth case is a 72-year-old female with the right eye neovascular AMD CNVM 8. Aflibercept had been given to the patient. Here we can see CNVM with SRF, 8-week post-injection. It had completely resolved. 12 weeks, again there was a recurrence. And again, aflibercept was given. So again, 8 weeks, that was the pattern. 8 weeks, it was all going well, and there was a recurrence at 12 weeks. So at this point, Ferricimab was offered, Ferricimab was injected. And here we can see that 12 weeks post-injection, patient is maintaining the dry state. But there was a recurrence at 16 weeks. Our fifth case is a 79-year-old male with the right eye neovascular AMD scarring CNVM. Patient had received 8 injections. So here we can see that the injection was given. Patient was followed up at 8 weeks. There was minimal kind of response. Again, we injected. Again, there was a minimal kind of response. So after 4 injections, the patient settled down, PD had gone down, SRF had gone down. But at 12 weeks, again there was a recurrence. So at this point, faricimab was injected and patient had a complete drying at 4 weeks, maintained at 12, 16, and there was a bit of recurrence at 20 weeks. So our sixth case is a 51-year-old female with a left eye PCV. Patient had received loading doses of aflibercept, monthly consecutive doses, and 4-week post third injection. Patient was doing well. Patient lost to follow up, then came after 6 months with a PED and SRF. At this point, faricimab was given, and at 4 weeks, we can see that the PED is still regressing. SRF had completely resolved, and at 8 weeks, that PED has completely flattened out. Our seventh case is a 63-year-old male, right eye neovascular AMD, scarring CNVM. A total of 10 injections had already been given to the patient. So here we can see the IRF, aflibercept was given, 4-week post-injection, completely dried. Then there was a recurrence at 8 weeks. So we again injected with aflibercept and the pattern followed. 4-week post-injection, there was complete drying but recurrence at 8 weeks. So at this point, faricimab was injected, and as we can see that the patient has maintained the dry state at 8 weeks and it's still on follow-up. So summarizing my presentation, our experience with faricimab has been in patients who have received other anti-VEGF agents previously and showed recurrence in shorter time intervals. PD regression in PCV is significant with durability varying from 8 to 16 weeks. Equivocal response, what we have found in DME cases, and the durability in neovascular AMD varies from 8 weeks to 16 weeks. So concluding my presentation, anti-VEGF molecules inserted within vitreous cavity have a lifespan. It's a challenge to obtain a perfect molecule which is capable of stabilizing the disease process as well as sustaining its efficacy to a suitable duration. Innovation, clinical trials, and our own clinical experience guide us to implement the best for our patients. Thank you.
Yeah, very wonderful presentation. Again, okay, so I mean, have you tried the loading dose in any of these patients?
Yes, sir.
The loading dose?
No, sir, we haven't tried any loading doses.
Because
yet.
all the switch patients
Yes,
probably.
sir, yes, sir.
Yeah, so
all patients had received anti-VEGFs previously and then we switched to faricimab.
yeah, so
because
that
of the durability and other
so
issues.
we were talking the same thing, that the concern is that the switch patient, it's difficult to start the loading
Yes,
dose.
sir, yes, sir.
Yeah. Anything?
Ask you one thing.
Yes, sir.
Many of our ILIA patients and Vabysmo patients are on 12 weeks interval. So do you follow any protocol? Let's say today you have given the injection.
Yes, sir.
You call him after 12 weeks or in between? You
No,
call
sir, we are following them on a monthly basis maybe.
monthly basis.
And if we know the pattern of recurrence, then maybe we can call them after 8 weeks or 12 weeks. Thank you.